pregnancy, the most wonderful time of your life, when you have a baby or more than one baby growing inside of you. Hi there, I'm Trisha and this is Rani. Now you might be overwhelmed with a few terms thrown at you from all sides, from people you meet, people on the internet, your doctor. But in today's video, I will be giving you 10 terms that you need to be familiar with since you're pregnant. Number 1, trimesters. Now, since your pregnancy is over a span of 9 months, ideally, it is divided into 3 parts. So the first 3 months are called as first trimester, the next 3 months the second trimester, and the final 3 months is the third trimester. And this is done so that you can properly differentiate what you're going through and how your baby grows inside of you. And there are certain milestones that you will have to achieve, and you'll realize how it feels as you grow, as your body changes and as your baby grows inside of you. Number 2, antenatal or prenatal care. This is nothing but the care that you receive from the doctor when you are pregnant or before your baby is born. So ante or pre, before the baby is born. Number 3, postnatal and postpartum. They are not the same, but they are used as synonyms everywhere, and it is okay since everybody associates it with afterbirth. So actually what postnatal stands for is the term used in reference to your baby, and postpartum is used in reference to the mother. For example, postnatal care for the baby, postpartum stress, or the postpartum depression. Number 4, ultrasound scans. These are also called a sonogram. So the scan is done by sending sound waves and capturing the image of your baby to find out how the baby is doing inside of you and if everything is fine. So the doctor will recommend when you need to do the ultrasound scan, and you can do it, and also get 3D images when you are in your 9th month, so that you can capture your precious baby's picture when the baby is inside your womb, and that is really one amazing experience. Number 5, NSTs or the non-stress test, and this test is done to check the baby's movements, the baby's heartbeat, and how the baby responds inside you when you are lying down or when you move. So basically just to test that the baby is doing fine and the heartbeats are normal. Number 6, morning sickness. This happens usually in the first trimester, or in some cases it can also happen throughout the pregnancy. Ya baba, ya baba. So you start feeling nauseated or get bouts of vomiting in the first 2-3 months of your pregnancy. And in many Hindi movies they show that the girl finds out she's pregnant just because she has started vomiting in the morning. It's not true in all cases. You need not always, not every pregnant woman gets these bouts of vomiting. Some of them don't, some of them do, and that is called as morning sickness. And also this is not that, it's not that it happens only in the morning, it can happen at any time of the day. In general it is called as morning sickness. Number 7, heartburns. Heartburns usually occur in the towards the end of the second or the third trimester, when your belly grows and you feel a burning sensation in the food pipe or the esophagus. It's a burning feeling you get when, especially at night when you're about to sleep, when whatever you have eaten during the day starts burning your food pipe. And that is only because the uterus is putting pressure on your stomach, or the uterus is growing, and it's understandable. And it goes off once you deliver and once the baby is born. Number 8, labor pains. So labor pains are the contractions felt in the uterus when your baby is ready to be born. So the uterus sends you signals by contracting, and it pains, and your abdomen and your back starts aching a lot. So that is when you know it's the true labor and it's about to begin. There are 2 types of labor pains. One is the true labor pain, which leads to birth, the childbirth, and the other one is the false, which leads us to the next point. Number 9, Braxton Hicks contractions, which is the false labor, also called as false labor. This is your uterus preparing for childbirth. Twinkle. Felt only in the abdomen because the uterus is stretching and adjusting to the baby inside you. Number 10, Linea nigra, which is the vertical black line which appears on your belly. So this line appears in your 8th or 9th month, and also goes off once you have given birth after a few weeks. So there's nothing to worry, there's no need to worry about that. Thank you for watching. Please do leave a comment below if you have learned anything new today. Please subscribe to my channel. Bye.